Are you forgetful? Have you had memory lapses? Do you forget where you put your keys or parked your car? Do you have trouble finding words, concentrating or maintaining your train of thought? Have you forgotten someone's name? Do you refer to these events as a senior moment? Is there such a thing as a senior moment? Is being forgetful a normal part of the aging process? Or is it a sign of a degenerative disease which is destroying a person's memory, ability to learn, and ability to carry out daily activities? What are the most common risk factors for Alzheimer's disease? What recent medical developments provide hope that therapeutic breakthroughs may occur in Alzheimer's treatment? To answer these and many other questions, I've invited Dr. Robert Portney, a geriatric neuropsychiatrist, to be my guest. Dr. Portney graduated from Yale University School of Medicine, performed his residency and internship at Hospital University of Pennsylvania, and a fellowship at Cambridge Hospital, Harvard University. He sits on the faculty of Harvard Medical School and serves as a supervising physician and clinical instructor in the combined Mass General Hospital and McLean Hospital training programs. Dr. Portney, it's great to have you on the program.
Pleasure to be here. Thank you.
Okay, so let's start first of all with regards to memory loss. Is memory loss a common thing for people who are growing older?
As we get older, our speed of retrieving information may be a little bit slower, may be reduced a bit. But we don't usually find significant deterioration in cognitive capabilities unless there's a disease process. It's speed rather than the ability to recall.
Okay. And so that type of memory loss to which you referred, how is that different from degenerative disease, which you refer to as dementia?
Well, years ago, we thought that as we aged, we lost a lot of neurons, that the brain cells, we thought, just died off because we saw atrophy when we did scans, MRIs, CAT scans, etc. But it turns out that very few brain cells or neurons are actually dying or dead. The more of what's happening is that we're losing the ability to produce certain neurotransmitters, and the actual building blocks, the cells themselves, shrink, they atrophy. So the reason the overall brain shrinks is primarily due to the reduction in the size of the individual neurons. When you do cognitive testing, we do see some slight drop-off in cognitive and memory abilities as we age, but it really isn't that significant unless there's some other disease process. But the diseases could be as varied as somebody having an underactive thyroid, a depression, a medicine with a side effect that we typically refer to as being anticholinergic. It could be something that is inducing an inability to concentrate, such as pain. It could be many things other than that which we fear being a dementia or Alzheimer's. And Alzheimer's is just one specific neurodegenerative process that leads to the loss of cognitive abilities, including memory.
Okay. So do you ever have patients that present to you with symptoms that appear to be some form of dementia, such as Alzheimer's, but later you discover are something else?
Yes, many times. And in fact, when we meet with individuals, that's what we're looking for, and that's what I'm hoping for.
You're hoping it's something else.
Something else,
Right.
especially if it's something else that's treatable, can be modified in some manner, or curable. So that something like a major depression might lead to something called pseudodementia, in which you might ask the patient many questions to test their memory, and you'll get a lot of wrong answers. But frequently with pseudodementia and with depression, you get answers such as, I don't know. But somebody with an underactive thyroid, somebody with a cardiac arrhythmia or congestive heart failure, or something that is compromising blood and oxygen delivery to a vulnerable brain, somebody with sleep apnea, obstructive sleep apnea. There's so many medical disorders that can produce symptoms that mimic a dementia, and in some instances, if allowed to progress, could actually induce a dementia, but may be curable or totally reversible during the earlier stages, and sometimes those earlier stages could be several years.
Now, are there common risk factors, for example, family history, someone's sex? Are there common risk factors for dementia?
Well, years ago, people used to say that aging was a risk factor. And people then said, well, age causes dementia, with the assumption being that if you're 90, you'll be demented. Well, it turns out that dementias are far more common, whether it's Alzheimer's or other dementias. They're typically more common with advancing age, but it is not a natural outgrowth of the aging process. But the truth is, if you look at the average 30 or 40-year-old, they're not demented, and look at the average individual over 100, they may well have significant cognitive deficits, almost all those individuals, except a select small percentage. So we know that high blood pressure is a significant risk factor for the development of not only dementia, but vascular dementias and actually Alzheimer's as well. We know that dyslipidemia or hypercholesterolemia is a risk factor not just for dementia, but vascular dementia, stroke, and Alzheimer's as well. It turns out that vascular disease is a major risk factor for Alzheimer's. Inflammation anywhere in the body, but especially if it gets towards the central nervous system, is a risk factor for cognitive decline and may be a greater risk factor for Alzheimer's, because apparently some of the pathological changes of Alzheimer's, namely the plaque formation that is found in the brains of individuals with Alzheimer's, plaque is more vulnerable, more likely to occur if you have some sort of inflammatory disease process going on. Traumatic brain injuries. A beautiful study was published in the mid-1990s which looked at 16-year-olds who were sitting in the front seats of cars as passengers. They weren't driving, they were just sitting there. The cars had head-on collisions, unfortunately, and these were kids who weren't wearing seat belts. The kids who died instantly, neuropathologists pulled their brains out and looked at their brains under a microscope, and they didn't find any changes of Alzheimer's. They found trauma, they found a hemorrhagic response, but no pathology of Alzheimer's, such as neurofibrillary tangles or the plaques that are commonly seen, several of the neuropathological changes that are noted. But within 2 to 10 weeks after the accident, those individuals who lived and then died over the next 2.5 months after the accident, they found dramatic increase in plaque formation. And it turns out there was something in the trauma that led to a hemorrhagic response, that led to an inflammatory response trying to clean up the damage, that led to the plaque formation. And had those 16-year-olds lived, they would have been cognitively impaired, in part due to the trauma, but in part due to the pathological changes involving the inflammatory reaction trying to clean up the microhemorrhages.
Now, we know that professional football players are involved in a very violent game, and they sustain head injuries.
That's right.
Are they more likely, professional football players that is, more likely to, in the future, develop some form of dementia, such as Alzheimer's?
Well, it turns out they're at a significantly increased risk for dementia, but more specifically, my understanding is an 18-fold increased risk for Alzheimer's at any given age. And so in your 60s, it might bring on a dementia because you had traumatic brain injuries at a younger age that might not have developed until you were in your 80s or 90s. It might bring it down a decade or two or more. So that, is it worth it being in the NFL, making a few $1 million for a few years, to then conceivably develop a dementia 2 decades earlier? And you couldn't pay me any amount of money. So all I could imagine is while Tom Brady is playing for the Patriots, and his wife is a supermodel, and they're both making millions and millions of dollars, he has to calculate what's the risk for extra money. And no amount of money makes it worth it. And I assume the reason why a quarterback like that might keep pursuing the game is because that's what he loves.
Right.
But it
becomes his passion,
heck of a risk to take.
So what should a person who falls into one of these risk factors, somebody who has a family history for Alzheimer's, somebody who's had traumatic brain injury, someone who has high blood pressure, what can they do when they're still younger in order to minimize the possibility of someday developing Alzheimer's?
There's actually a lot we can do to change those modifiable risk factors. We can't change the biology necessarily, but we can change environmental risk factors and our behaviors. Exactly what you do to reduce the risk for a heart attack or a stroke is what's needed to reduce the risk for degenerative changes in the brain, including Alzheimer's. So that means maybe a Mediterranean diet, a lot of fish, a lot of vegetables, a lot of fruit. It means avoiding high cholesterol foods. It means trying to avoid becoming obese. It means having your blood pressure controlled. It means if your cholesterol and triglycerides are elevated, do something about it, whether it's diet, exercise, or taking a medication. It means that you need to live a lifestyle in which you exercise regularly, and you eat a healthy diet, and you live what's called a healthy lifestyle. And there are actually studies published in the mid-2000s, 2005, 2006 in the Journal of the American Medical Association and in the New England Journal of Medicine that looked at the beneficial effects of exercise in reducing the risk for future cognitive deterioration. And they actually have done studies looking at men who are walking vigorous exercise several miles a day. In fact, one study looked at 4 miles a day and found significant reductions. We're not just talking 5, 10%, but significant reductions approaching 50%, and one study even more, reduction in the prevalence rates for the subsequent development of a dementia, and studies looking at reduction in the development of Alzheimer's. Diabetes and metabolic syndrome are disastrous. So if you're a type 2 diabetic, just taking insulin to bring down your hemoglobin A1C is not all you can do. You need to reduce your insulin resistance, and many times diet and exercise can be useful for that.
Okay, so let's talk a little bit about some other studies that I've read. Okay, for example, there's a study that says that having an MRI scan of your head can be a predictive tool. Do you agree with that?
MRIs will tell you, and let's look at both MRIs and MRAs. One looks at the vasculature, but MRI looks at structure. And if you see atrophy in certain portions of the brain, it might tell you there's a reason to be concerned. But yes, an MRI is a very reasonable tool to use in both the workup and diagnosis of a dementia. Alzheimer's and dementia is a clinical diagnosis. It's made by seeing evidence of the deterioration in cognitive abilities and memory. There are a number of cognitive abilities as well. But it really is, by and large, a clinical diagnosis that only can be made, such as Alzheimer's, with certainty after the patient dies.
Now, there are also some studies that indicate that anti-inflammatory medications like ibuprofen may be helpful for somebody who's developed Alzheimer's. Is there anything to these studies?
Yes, there was a study published by Veld out of the Netherlands in 2001. It was either the New England Journal of Medicine or the Journal of the American Medical Association. I think it was the New England Journal of Medicine. I think it was November 22nd, 2001, that looked at almost 7,000 individuals who were followed for almost 7 or 8 years. And they looked at those people who took nonsteroidal anti-inflammatory drugs versus individuals who did not. And they found at the end of the 7 or 8 year period in almost 7,000 people, a significant reduction in the prevalence rates for the subsequent development of an Alzheimer's dementia.
Okay, so let's talk a little bit about vitamin E. There's a study that says vitamin E may be helpful. Now, I also know in the past there were studies that said vitamin E was helpful for other things, and since there are new studies saying, well, that may not be the case. Is vitamin E helpful with regard to Alzheimer's?
I don't believe at this time that the data on vitamin E is useful.
How about estrogen replacement therapy? There are studies that seem to tout that.
It appears that if you take in midlife, during the perimenopausal period, that if you take an estrogenic hormone, then for a 6-month to maybe 2-year period, it might have a neuroprotective effect a decade or 2 later to prevent the development of Alzheimer's. But there might be a role for low-dose estrogenic hormones during the perimenopausal period that might reduce the risk decades later. But the problem is, does it increase the risk for other malignancies, and does it increase the risk for strokes and heart attacks?
There are also other studies that state that perhaps if you engage in certain memory-type games, like doing crossword puzzles and so forth and so on, may be helpful. Is it in fact helpful?
Yeah. The data on basically brain exercises, if you play bridge, learn chess. If you play chess, learn an instrument. If you play an instrument, maybe learn a new language. If we basically increase or stimulate the brain in different ways, in novel ways, that appears to have a neuroprotective effect. But a healthy diet and exercise serves the individual well. We just need more studies.
Do you think that someday we'll have a vaccine that will help eliminate or at least minimize the effects of Alzheimer's?
If you asked me this in 1998 or 1999, I really thought Elan Pharmaceuticals at the time was doing a study that they were coming up with something that would cause plaque absorption and destruction. The problem is the clinical trials on humans were not very successful due to encephalopathic changes, brain swelling, and I think there might have been some seizures. So you need, obviously, efficacy, but you need safety. And so in 1998 or 2000, I would have said, yes, I really believe it's coming soon. I'm now far less hopeful. Scientific progression has been remarkably slow, and the agents that we use today, like Aricept or donepezil or Reminil or Razodine or Galantamine or Exelon or even Namenda or Memantine, these agents have a beneficial effect and they can slow progression, I believe, significantly. But these classes of drugs are almost 20 years old now. And very little advancement has occurred over the last 10 years, even though we've got all these theories and science is advancing, but it hasn't translated into clinical cures or more effective treatments.
And I would also think that more and more people are aware of this condition. I would think more and more money is being spent on trying to develop some sort of resolution. There's no cure for Alzheimer's, right?
No cure.
Okay, I think that's a good place for us to stop. Today we learned that Alzheimer's disease is a brain disorder that affects millions of people in the United States. It is reported that the number of Alzheimer's patients is expected to triple in the next 20 years. Just like the rest of our bodies, as we age, our brains change. Most of us notice some slowed thinking and occasional problems remembering certain things. In the past, people believed memory loss was a natural age-related decline. However, today we realize that serious memory loss, confusion, and other major changes are not a normal part of aging. They may be a sign that brain cells are failing. Alzheimer's disease gradually and painfully destroys a person's memory, ability to learn, and carry out daily activities. As the disease progresses, individuals may also experience changes in personality and behavior. Unfortunately, there's no cure for Alzheimer's disease and therefore no survivors. The good news is that early Alzheimer's diagnosis and treatment can slow the progression of Alzheimer's symptoms. Early and accurate testing can rule out Alzheimer's disease and thereby identify and treat another condition that presents with symptoms similar to Alzheimer's disease. On the other hand, it can identify the presence of Alzheimer's disease and thereby give the patient and family an opportunity to plan for care, housing, and finances. Recent developments in basic research suggest that therapeutic breakthroughs may occur in Alzheimer's disease treatment, however, over the coming decades. Therefore, educate yourself to become more aware about the warning signs of Alzheimer's disease, the treatment and care available, and how to pay for both treatment and residential care. Also, locate a competent and compassionate physician, such as Dr. Portney, who understands the various aspects of Alzheimer's disease and the effective treatments available to provide the best medical care possible. Lastly, determine what financial and estate planning, if any, has been accomplished. The appropriate planning may simplify the decision-making process and avoid the necessity to apply to the courts for a guardianship or conservatorship. As Ben Franklin was quoted as saying, an investment in knowledge always pays the best interest. In closing, thanks to my guest, Dr. Robert Portney.
Thank you very much.
And as always, thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, building your trust.